Thank you. So good afternoon and welcome to our training, Collaborative Approaches, DCS, and School Social Workers. So my name is Caitlin Bowers. I am the FFPSA Regional Prevention Consultant in Northeast Tennessee. And prior to my position as a prevention consultant, I served as a school social worker for Knox County Schools for close to a decade. I supported students in pre-K through 12th grade and about 20 different individual buildings throughout my time with that district. And today we just want to enhance everybody's knowledge about working within the school systems and how we can partner to utilize better prevention practices. So I'm going to turn it over to Kristen for her introduction as well.
So I'm Kristen Bohannon, and I am the prevention consultant in East and Tennessee Valley regions. And prior to my role with SWORPS, I was with DCS for 12 years. I was a case manager for CPS and foster care, and then I was a team leader for FSS and FCIP. So as Caitlin said, today's training explores strategies for building effective partnerships with school social workers. Excuse me. We hope to deepen your understanding of the distinct roles and responsibilities of both school social workers and frontline child welfare professionals. So this session will also highlight best practices for collaborative case planning and resource coordination to optimize outcomes for children and families. And if you don't care, just so we can see who all is on, if you could drop in the chat your name and what your job role is and like where you work, that would be very helpful. So first, we want to explain what school social workers actually do. School social workers' responsibilities include family support, developing intervention plans, crisis intervention, resource assistance, truancy support, assessing, and home visits. So what are the differences between school social workers and school counselors? So this is a comparison chart for school social workers versus the school counselors. The school social workers' primary role is to support students with social, emotional, and family-related challenges, while the school counselor guides students in academic achievement, college or career readiness, and personal growth. Both are typically master's level, but often the school counselors hold a degree in school counseling or related field. As far as specific services that each provide, school social workers provide crisis intervention and that home visiting and case management and linking families to community resources, where school counselors provide academic planning, college prep, short-term counseling, and group guidance. The school social workers prioritize at-risk, underserved, or high-need students and families, and school counselors typically work with the entire student body on the academic, social, and emotional development. Social workers collaborate heavily with families, child welfare, and other external agencies, where the school counselors collaborate more with teachers, parents, and students within the school. With common issues like abuse, neglect, homelessness, truancy, and mental health being addressed by school social workers, and academic performance, peer relationships, and testing being handled by school counselors. But keep in mind that in some smaller school districts, you may not have both a school social worker and a counselor. So you may have one or the other, and sometimes their activities may overlap. So next, I wanted to highlight some of the what school social workers are doing in different areas of the state. Maybe this will give you some ideas about how increasing your communication can benefit everyone. Many school systems are deeply invested in addressing social and emotional issues and helping families be strong and successful. Sorry, I got to get a drink. Okay. So in Hamilton County, they have 75 school social workers in their schools. The school social workers are certified in school social work and trauma and therapeutic crisis intervention, as well as able to do DBT and DIR for neurodivergent children. They also perform mental health first aid for both youth and adults, and they practice restorative practices. They provide individual counseling that's more intensive and longer term than the school counselors provide, and they're all master's level. They are able to refer out to community providers for special needs and contract with Centerstone, Helen Ross McNabb, and the Mental Health Cooperative for school-based counseling services. But those providers only see students with TennCare, so the school social workers are able to fill that gap. The Hamilton County School Social Workers also have access and conduct universal housing assessments. These assessments determine eligibility for housing and aligns the family with appropriate housing options and places them on waiting lists for public housing. In Bedford County, their school social workers have received numerous grants for services and programs. They only hire licensed social workers or mental health professionals, and they can do various counseling services. They also work to provide food and basic necessities for families and conduct home visits when necessary. Due to having a large Hispanic population, several of the social workers on staff speak Spanish. In Putnam County, they have 6 school social workers, 5 of which cover 20 schools in their district. There's 4 licensed master social workers who are working toward clinical licensure and 2 who are LCSWs. They provide individual and small group counseling. They work alongside Health Connect and Centerstone to provide individual counseling, with those agencies also providing services to TennCare students. They provide family counseling and community resource referrals when needed and work closely with the Family Resource Center to provide basic needs for families doing home visits and deliveries. And they provide support to teachers for student behaviors and training. And they're members of the trauma-informed school team for each of their schools. And then in Memphis and Shelby County, their licensed school social workers and school psychologists offer an array of school-based mental health services that includes individual, group, and family therapy, alcohol and drug intervention, functional behavior assessments, emergency crisis response, and threat assessments. They also offer parent empowerment sessions. So these include topics such as depression, anger management, grief and loss, mood disorders, trauma and the brain, relationships, anxiety, self-esteem, mindfulness and self-care, suicide prevention, social media, and divorce parenting classes and stress management, and building positive communication. So if you know of additional services that school social workers provide in your area, please feel free to add that to the chat. So here are some benefits of effective collaboration with schools. If we effectively collaborate with our school counterparts, that increases trust and engagement with families. A unified approach can build greater trust and facilitate family participation in services. Earlier identification of risks allows for more timely intervention and prevention efforts. Reduced duplication of services, efficient use of resources, and this avoids overwhelming families with multiple or uncoordinated interventions. It enhances communication and understanding by breaking down silos and fostering mutual respect and knowledge between the agencies. It creates stronger safety nets, creating a more robust system for support for vulnerable children and families. And it improves outcomes for children and families with a more comprehensive and coordinated support, leading to better safety, stability, and well-being. So some examples of ways that you can collaborate would be to reach out when needs are identified that could be addressed within the school. If truancy, academic progress, school behaviors are an issue, communication with the school is very important. And DCS staff should attend school meetings when possible. You can also invite teachers, coaches, and social workers or principals to child and family team meetings to build more support for the family. So we acknowledge that there can be challenges to collaborating with the schools. Those primary challenges are maintaining confidentiality and trust and communication issues. We recommend developing clear ethical guidelines for sharing information, such as completing releases of information. And this can be expressly for sharing info for service planning or meeting the needs of the family, and is not meant to share investigative or sharing HIPAA protected information. Examples could be that a family needs connection to a specific service or resource that the school social worker can assist with, or help in planning a CFTM and attempting to identify additional supports or potential placement options for a child. Other potential ways to enable collaboration would be to develop formal agreements, such as a memorandum of understanding or an MOU, outlining how information can be shared legally and ethically while respecting confidentiality and ensuring child safety. But this would involve central office and legal, but it has been done in some areas. It's also something that school social workers I have talked to have asked about because they worked in areas that did have an MOU with DCS. We also recommend building relationships with school social workers and other school personnel through regular contact, open communication, with a focus on shared goals. By actively working together, DCS and school social workers can create powerful partnerships that strengthen families and ensure the safety and success of children. So what do schools need from DCS? Schools frequently ask for insight on what happens in CPS cases, really just in general, not case-specific or confidential information. They also frequently ask to be notified as soon as possible when a child's been removed, if that child's not coming back to the school, because if they're not notified timely, they worry that something may have happened to the child. So we further recommend that DCS educate school systems on evidence-based prevention services available in the community, which is something that myself and my counterparts across the state can help with. We also encourage you to educate about DCS and investigative process, on mandated reporting, highlighting the difference between abuse and neglect versus poverty and lack of resources. To teach the school personnel to consider whether a family just needs connection to resources, maybe resource linkage could be an option, or when schools are aware of community-based services, they can refer to those services themselves, preventing unnecessary DCS involvement. These things could be accomplished by implementing regular meetings monthly or bi-monthly, or check-ins to share information on cases or just in general system issues. It can be done by regional leadership or team leaders, or the creation of a multidisciplinary team, and would work best if there was something like an MOU in place. We also recommend conducting joint training sessions, educating each other on respective roles, responsibilities, legal mandates, and agency culture to foster better understanding and collaboration. You could share general information about DCS policies or investigative processes, share info about community resources, and then learn what's going on in the school system. Now I'm going to turn it over to Caitlin.
Right. So for this slide, I would love to delve into some information surrounding mandated reporting in the schools. So as we all know, school staff are mandated reporters, as is everybody in the state of Tennessee. And lack of proper reporting practices can result in teachers, administrators, or school staff to lose their education and professional licenses. So they take mandated reporting very, very seriously. And as an extra layer of proper reporting practice within schools, Tennessee law designated that each LEA, or local education agency, which is essentially an individual school, must designate a child abuse coordinator. So I've served in that role myself in my previous role as a school social worker. And the coordinator is really there to support and educate staff in proper reporting practice and maintain appropriate records when it comes to intakes and reporting. So I just want to take a moment to give some insight into what that looks like at the school level. So a child makes a disclosure of abuse or neglect to a staff member. That staff member immediately notifies the child abuse coordinator in the building. And that person typically is a school social worker or a school counselor. Sometimes that individual can be an administrator based on the availability of student support in that building. But that staff member is going to come to that coordinator and we're going to consult about what that child disclosed and if it rises to the level of abuse or neglect and reporting. So if that disclosure requires a report to DCS, we ensure that the staff member has the appropriate tools to report. So that means they have the hotline phone number or the intake link for the online reporting page. And we also help them make that determination of if it can be reported online or if it needs to be immediately called into the hotline. So the coordinator also educates the staff members on what they need to include in an intake or a report. So I would always tell my staff, be sure to be concise. Don't add opinions into your report. Be very factual. State exactly what the child stated. Be sure that you have your face sheet, which is your student documentation, ready. So you can just type all that information in fluidly. If you're calling into the hotline, we try to be very mindful of their time and have that information ready for them, from the get-go. So the coordinator also makes sure that the staff member feels safe and comfortable with the reporting process. So we will walk them through that. My experience has always been that the majority of teachers can be very intimidated by the reporting process. The coordinator can be there with the staff as they're making any reports just for moral support, or if they have a question during the reporting process. We also let them know that they themselves are the ones who have to report. So if a child makes a disclosure to them, we let them know we can't make that report for you. We will sit with you. We will help you gather information that you need for that intake, but you have to make that report. And so that can be very hard, especially for new teachers or new staff members or younger staff members. So really just educating them on that process. So in my former district, we had to report every reporting ID that was made within the schools to our school security at central office. And they would keep just very basic information. They would ask the last name of the student, the intake ID, and just a very broad allegation. That way we kept very clean, concise reporting records on our end as a system. And these child abuse coordinators were a big part in that. We made sure security had that information, and we also kept individual records for the school. So if done appropriately, these coordinators are crucial to the relationship with child welfare professionals. As I said before, the coordinator is typically a school social worker or a counselor. Some schools will make an administrator the child abuse coordinator if they don't have that regular student support presence in the building. And you're more likely to see that in your smaller districts where maybe they have some challenges, funding challenges with getting proper student support in the building. If that is ever the case, I would still encourage staff to reach out to a school social worker or counselor as a point of contact. There are wonderful administrators out there, but they aren't necessarily as educated around child welfare practice as a lot of your school social workers and even your school counselors will be. So, next slide. So how to collaborate effectively with the child abuse coordinators in your schools. So the child abuse coordinator really should be a first point of contact for a child welfare professional after, you make contact, if you need to make contact with the referent. They should have a very accurate picture of the report that's been made and the information surrounding that reporting event, because they do debrief with staff and make sure that all the relevant information is supposed to be included in that intake. So the coordinators should have a very team-focused mindset when it comes to working with child welfare professionals. Say if you're having issues with the front office, maybe being a barrier to you pulling and seeing a child that you need to see, or you're having issues with a staff member, really let that coordinator be your advocate within that building and really foster that rapport and a close relationship with them, because they can be that advocate for you and kind of stand up for you in those situations. Especially if that coordinator is a school social worker or a counselor, be sure to follow up with them throughout the progress of your own case. If a child did make a disclosure that has risen to the level of a report, the coordinators will more than likely be doing regular check-ins with that student to ensure that they continue to feel safe at school and at home. So they may have other relevant information that would be helpful for you to know as the case progresses. So if the department is working with a really sticky case or situation and they could use an extra layer of support, consider getting a release of information just for that abuse coordinator or a school social worker or school counselor. So a great way to approach that conversation with a family would be saying something like, we want to have a release with this specific person at the school. We want to ensure that the school is utilizing all the resources that they can to support your child, and having an open line of communication between myself and this person can really ensure that that is happening. So we're doing this, in the best interest of your child. And we are. Everyone's common goal in that situation is to do what's in the best interest of the child and the family. So this is a good way to maintain confidentiality and ensure that parents know that their private information won't be shared with their teacher. Obviously, there's a lot of shame with families regarding having DCS involvement, and no one really would want their child's teacher or everyone in the school to know all that information. So really reiterate the boundaries around confidentiality if you are that child welfare professional with your abuse coordinator, your school social worker, your counselor, and really be explicit about what can be shared between the parties and what is okay to share with other school staff like administrators. Because sometimes there are situations, say if you did get an ROI between yourself and a school professional, that really needs to stay between the two of you and leave that planning to that school professional. So really be explicit and reiterate those boundaries with staff. So a quick reporting guide for schools. Right now, we are in the process of developing just a quick reference guide for school staff on how to make an effective intake or report to DCS. As a prevention consultant, part of our role is to do deep dives into case histories for frontline professionals and match those families with appropriate services and help them with locating, the best evidence-based services to be in that home. And in that process, I have read several reports from schools, and I do think a quick reporting guide would be very helpful, because I've noticed that sometimes schools struggle to make really concise reports at times. So if you feel like any of the schools in your regions could benefit from an intake training or support on how do you make an effective, concise report to DCS, please reach out. We'll have our information here at the end of the presentation and let us know. We would be more than happy to set that up and help, provide a training for schools that may be struggling with that intake process. So as a coordinator, here's some of the things that we share with school staff about reporting. One of the most important is confidentiality and explaining that as an adult, we don't make promises that we don't keep, and explaining that in a very age-appropriate manner. So saying things to kids like, I won't tell anyone or agree to keep a secret is not something that we should ever do. You can say things like, anything you say can stay between us, except if someone is hurting you or if you hurt or want to hurt someone else. So really explaining confidentiality in an age-appropriate manner. We also educate staff around issues of reporting and discussing those allegations with those children and students, and really reiterating that as school staff, it's not our job to investigate any validity of any claim that a child makes. Our job is to report the information that a student is telling us, and also letting staff know that asking any probing or leading questions can really hinder the actual investigation that the department is trying to do. And at the end of the day, we don't want to do anything that will hurt the child in the long run, because that is our goal, to do what is in the best interest of that child and that family. So really be aware of not asking for more information than you really need to, or trying to investigate any validity of any claim that a child does make. So brief introduction to information about tier-based truancy systems. So I get questions a lot about what does that tier-based truancy system look like. So I've broken it down into a tier system. This is typically what most schools use for truancy interventions. So foundational supports, this is typically handled by school counselors, so we'll make those distinctions. So this ensures a safe, welcoming school environment, working on peer relationships between students, doing those class-wide guidance lessons. So really just fostering a positive school environment. Tier 1 are universal preventions. That's typically also a school counselor. Those are like fun school-wide incentives for kids having good behavior and good attendance at school, like giving shout outs over the intercom for kiddos that have helped another peer or have had great attendance or great behavior, or little like reward parties for classrooms. So tier 2 is where social workers really start to become involved. So we do a lot of student data tracking. We look very closely at who is starting to have truancy issues at this point, or severe emotional or behavioral issues. So this starts to look like calls home to parents, having some uncomfortable conversations about maybe some behaviors or school attendance. Meetings at the school and coordinating those to see what interventions we can put in place. And look at more school-based intensive interventions. Tier 3, this is also where social workers are very heavily involved. So this looks more like we're going out and doing home visits on days that the kids aren't at school, and making sure that we're helping put in appropriate community supports and resources for that family to address the truancy. And this is really the last stop before juvenile court involvement. So really, before a child becomes involved with the system, especially for truancy, these levels of support need to be in place first. So evidence-based truancy interventions that are great, and please feel free to share out with your schools if you have schools that you work with that have pretty severe truancy issues. Attendance Works is a website that have lots of great ideas and lots of support for truancy initiatives within schools. And just a quick breakdown of one of my favorite interventions as a school social worker was the calendar reward system. So say if we have a kiddo that's starting to miss several days, we would set an attainable goal for that kid. So say 2 weeks. That student would have a calendar printout in the front office and stickers of their choice, and it would have the days laid out for those 2 weeks. And every day they come to school, they get to come to the front office. They put a sticker on the day that they're there, and everyone in the front office, the administrators, the secretaries, the school social workers, we make a really big deal about how happy we are to see them and how glad we are that they came to school. And at the end of the 2 weeks, once they fill up their little sticker chart, they get a prize of their choice. And two of the most requested things were Sour Patch Kids and Takis. So that's a deal that I would make every single day. And it was really effective. And a lot of people are like, yeah, that's for little kids. Like that wouldn't work in middle or high school. It absolutely does. I was floored at the amount of middle schoolers and high schoolers who were just absolutely pumped about the sticker system and getting their bag of Takis or Sour Patch at the end of their 2 weeks. So that's just, it's very small incentive and not super work intensive, and it's really effective. And that's one of an example of, interventions that you can find on Attendance Works. So I cannot say enough good things about their site and the interventions that they have for schools. And, another piece of this is getting buy-in from the parents. So I would always call the parent, obviously let them know what we were doing and let them know how excited their kid was about it. Because even if the parent doesn't necessarily care about school or think that school's super important, if their child's really excited about something, they're way more prone to be excited about it too, and to get a little more buy-in there. School social work referrals. This is just kind of a brief overview of the process, what that looks like school-wide. So staff generally make a direct referral to the school social worker if there's any issue that goes beyond the scope of the classroom. So anytime you are looking for someone to work with about a specific issue within the schools, just remember school social workers, we really focus on the scope outside of the classroom. So that's community engagement, home visits, anything, resources, anything that needs to go outside of the school for a more intensive intervention. And counselors really handle what is in-house. And there is overlap sometimes, but that's, our big distinction. And just a few plans that kids have or can have within schools that could be really important to permanency planning or plans of any kind that are just a trove of information for workers are things like IEPs, individualized education plans. So just a broad overview, those are typically for kiddos who have special needs like autism. Sometimes that looks like emotional disturbance. That could be Down syndrome. That could be medically fragile sometimes. So a lot of good information if you're working with a family in those plans. A behavior intervention plan is for a child who's experiencing disruptive behaviors at school that aren't necessarily tied to a specific disability. So that's just how can we help that child and support them maintain in a classroom environment if they're showing aggressive behaviors that aren't typical for a child of that age. And a 504 plan is typically for students who have a medical or need a medical intervention at school. And those are very important for ensuring that we have the appropriate school nursing staff in each building to be there for support for those kids. So a lot of helpful information. If you stop in at a school and you're getting ready to meet with a student or a child, I would ask for their records just so you can look through some of these plans. And also for diligent searches, I always recommend that workers look at that school pickup list, because there's been several instances, even in my case reviews that I've done, where in the genograms, there aren't the same people that were listed on the school pickup list. And so that can be a trove of information if you are doing diligent searches. Really look through the school information and the school pickup list for known associates or contacts or people who could just be a support for that family or a collateral contact. So really be sure that you're looking through all those plans and all that information. And this is just something that I wanted to brag on my former district for. We had a wonderful partnership between our court designated school social work and our FSS department. So what that looked like was a relationship that they fostered themselves between the department and the school system. And if a student got to that tier 3 process, like we were looking on that infographic, instead, if it was appropriate, they would staff these cases together. If it was appropriate, instead of having that family or that child go all the way through the truancy and the court process, she could make an FSS referral between the schools and DCS and FSS, and they would staff those cases to see which ones were appropriate for that intervention. So that really helped avoid some unnecessary court involvement. And I would really encourage any district or any team, FSS team, FPP team, to really look into that and see if that's something that could be beneficial for your families who are experiencing truancy, to kind of get beyond that court component if it is appropriate. And this is just a little bit about our upcoming trainings. We have enjoyed being with you guys today and sharing some of the information about school social work and kind of how we can work more collaboratively. Our next training is Monday, May 19th, and it is about Caring Dads program and how it supports prevention work in Tennessee. So we would love to have you there for that as well. And here's some more training. So CHANT and CSS, and we have the dates there as well. So mark those in your calendars, and we would love to have you guys for that. Let's see. So thank you for being with us today. We really appreciate it. If you can, please scan the QR code for more information about FFPSA Regional Prevention Consultants trainings and upcoming events. And if you're interested in getting a copy of that quick reporting guide for schools, send us an email. And we're hoping to have that done soon, and we can send that out for anyone who's interested.
Does anybody have any questions about what we talked about today or comments?